My name is Lisa Brower, and I grew up in Belen, New Mexico, and I work as the director of therapy, but have training as an occupational therapist for Encompass Health Rehab Hospital. I am based in Albuquerque, New Mexico, but my company is based out of Birmingham, Alabama. My job responsibilities is to oversee occupational therapists, physical therapists, and speech therapists to ensure that we are providing the best patient care in an acute rehab setting, which means that we work in an acute care hospital, but we specialize in physical rehabilitation for people who have had strokes or brain injuries and things like that have had unplanned illnesses or accidents or surgeries. So the majority of the time, the therapists are working with their patients. In an 8-hour day, we spend about 7 hours a day working with our patients. The rest of the hour is either meant scheduling your patients or catching up on things that you need to get or documents you need to write for your patients. But the majority of our day is working one-on-one with our patients every day to help them get better. As a physical therapist, your training is really to get people up and moving. Um, if somebody injures their leg, you're going to do some leg exercises so they can get up and start walking again to be able to return to things that they need to do. As an occupational therapist, you take that movement and you put it into functional activities, such as being able to take care of yourself with your basic dressing tasks, or being able to go to the bank or the grocery store, or be able to go out with your friends and access in the community. Speech therapy not only work on if you lose your voice or have issues speaking, they also work on your ability to problem solve, your memory, really what we would call your thinking skills, and your cognitive tasks would be the main focus of speech therapy. But they also focus on swallow. After certain people have things like a stroke, they may not be able to eat regular food. So the speech therapists, they really work on your ability to regain your swallow so you can get back to enjoy what you want to eat. So I think, growing up, I was the kid that didn't really know what I wanted to do, but I had a pharmacist for a father, I had a grandfather as a doctor, and so I always had a passion for being able to help people or be involved in helping people get better. And then I had two family members for various reasons. One was in a traumatic accident, and one was born with a disability, who worked a lot with occupational therapy. And I got to see the differences that they made physically and how they were able to get better. But also, what I got to see was the joy in them being able to feel like themselves again. And so I was really hooked from then on and looking into occupational therapy, physical therapy, some realm of being able to work with people every day. I graduated from the University of New Mexico. I had a degree in biology, and then I took that again with my passion for working with people and also the human body into occupational therapy school again at the University of New Mexico. And I had to do multiple hours under different occupational therapists, which is a requirement to get into school, different volunteer hours and working in different settings, to really make sure that you have a passion and the drive to work with people in this setting or this type of position. After I got out of occupational therapy school, I actually left the state for a while. I moved up to Colorado and did some clinical work up there. And then I figured out that home was New Mexico. So I found my way back, and I actually was hired with Encompass Health as an occupational therapist 18 years ago, actually. So I started as a floor therapist, working with patients every day from all diagnoses. And then about a year and a half later, we had some people leave Encompass, and it opened up an opportunity for what we would call a lead occupational therapist or a manager of the inpatient therapists. So I took a leap, and I applied for that job, and I was lucky enough to get it, demonstrating some leadership skills in what I had done prior to when I was a staff OT. And then a couple years later, the director of therapy position opened up, and I was asked by my boss to apply. I guess there were qualities in me in regards to leadership skills, but also my passion for helping people. I hope to shine through every day. And so I was very blessed to be able to advance into this role. So really, I've done all the positions, which I think is very, very helpful for me to be an effective leader in the seat I currently sit in, because I've been there. I've been where all of them are currently at. In my high school years, I definitely think that my science teachers pushing me, just seeing that I had a passion for it, whether, as a teenager, whether I knew it or not, pushing me to go above and beyond and exert myself in the realm of, anatomy and physiology, or in the area of biology, because it just had an interest. So I got a lot of pushing from my teachers. I had friends in high school. Some of them had, more confidence issues or not. And so I think just being a friend, being able to listen to them, and being able to, you know, just be a person and be kind with them, was really probably the pivotal moment for me to think that I actually had the strengths and the skills to continue on the pathway of listening to people every day and just trying to be kind and empathetic to the people that I now work with every day, who we call the patients. So I would just say, some of the social aspects of being a teenager and really working through, the different levels of confidence and the different things that happen in relationships, um, really helps me practice the skills that I now use every day, and just really being kind and empathetic, and but being pushed to be responsible as well, and make sure that you attend the classes, make sure you turn in the things you're supposed to turn in, because I can tell you, right now, that that's everything, because I have to be responsible for the people that I work with every day. Find what drives you. Success is not in money, success is in happiness, because you're going to spend more time at work than you're going to spend outside of work. So I would say that, really believe that if you're driven to help people, there are many different avenues to do it. And I wouldn't discount any of them. And that really, I would go out and find opportunities to shadow people and talk to people about it and find your path, because that's how I got to where I am.